I planted some stuff. I've been watching my stuff come up. Every day I go to look in the buds for.
The time is 7 p.m. I'd like to call to order this regular meeting of the Newington Town Council for Tuesday, April 14th. Please rise for the Pledge of Allegiance. Pledge of allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Here. 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 Here.
Here.
Here.
Here. All right, we have a quorum. We want to approve of the agenda. Any changes that anyone needed to make the agenda? If not, I'd approve a motion, I'd entertain a motion to approve.
So moved.
Second. Motion by Deputy Mayor Ryder, second by Council Claude. Any discussion on approving the agenda? Seeing none, all those in favor?
Aye.
Any opposed or abstained? Motion carries unanimously. All right, we have a couple of presentations tonight that we're gonna have before into regular business. First on the list is from our good buddy Charlie Brown over at the Central Connecticut Health District for his annual presentation. Coming up, Charlie. Thanks for being here tonight.
Hello, everybody.
Hello.
Give me 1 second to get down here and get to my presentation. I'm ready when you are.
Right, go right ahead. Thanks for being here. Yeah, thank you for
Well-
being here. Beautiful day.
It is a beautiful day. So my name is Charles Brown, and I'll get a little closer to the microphone. Generally, they don't want me to get closer to the microphone because I'm fairly loud as it is. But my name is Charlie Brown. I'm the health director for the Central Connecticut Health District. We cover the towns of Rocky Hill, Berlin, Newington, and Weathersfield. And our main function is to do three things: prevent, promote, and protect. And we'll get into how we do that through this presentation. So some general information about CCHD. As I mentioned, we're the health department for those four towns. We cover a population of just over 100,000 people, residents right now. And we're coming into our 30-year anniversary come here in June. So we've been operating as a health district for 30 years, which is a big accomplishment. We're one of 20 regional public health agencies within Connecticut. So there are 20 health districts in the blue. Those are towns that are actually covered by health district. So more than one town getting together to kind of take advantage of economies of scale. The green are municipalities that have their own health departments. And then you may see three little gray ones that are still part-time health departments where they only have a health director on for part-time. When I came on the map, there was a lot more gray. Thankfully, we have more full-time now than we do part-time. So our central office is located in Rocky Hill on Solstein Highway at 2080. We also have clinical health services office at 506 Cromwell in Rocky Hill. We got 15 employees at this point. Several of them are funded by grants. And we have over 50 active and professional lay volunteers. And some of those folks are actually in our audience today, have volunteered for us right here behind me. So we thank them for their help because they allow us to get done a lot of things that we could not do on our own. We also have oversight from a 14-member board of health. It's made up of board members that are appointed by their towns, and that's according to population. So Newington being the most populated of our towns, you actually have 4 representatives, 3 of which are here tonight, and I'd like to recognize them. So first and foremost is Dave Wilmette. Wave your hand, Dave. Then we've got Bill McCarthy and Paula Siegel there in the back. So they're your representatives on our board, and they do a very good job for us for letting us know what your community needs are and to be able to communicate from us as a health district back to the community. So if you know them, use them. So let's talk a little bit about the bottom line to kind of start things off. So some information from our most current audit, 24-25. So 24-25, we actually had a revenue just over $2 million. And as you can see, it's split up almost third by third by third. Most of the contributions that we get in the past were from the towns. So the towns funded the majority of activities that we had through a per capita fee. So we get at that time, we got $8.85 per person per year to do all the things in public health that we needed to do. That's what we got from the towns. Through the state, we actually got grants through federal, state, and other grants totaling about $873,000. And this last year was the first year since I've been a health director that we had more revenue from grants than we actually had coming in from the towns. So it's a little bit of a good balance though, because they're pretty close right there. The third is program revenue. So we actually charge for things like the licenses for food service, for motels, for salons, and the inspections that we perform that allow them to function safely. So we charge for those fees for those licenses, and that actually brings in revenue. In addition to that, we do things like vaccinations, where we actually charge insurance companies for the vaccines as people come in, and we make a significant amount of revenue from that during the season. So all told, it comes into, like I said, about $2.1 million. Our expenditures are mostly our staff. So our personnel and their benefits for professional staff are what really keeps us going. We don't make widgets. We have our professional staff, and what they know and what they do is what our product is. And that's where our expenses really are primarily laid. We do have some program and operating expenses to run the office, just like anybody else, and then some contractual things, about $52,000. The good news, as you could see, we brought in $2.1 million. We spent just at 1.8. So we added a little bit to our reserves, which is always good. So the purpose of a public health agency, as I mentioned, there's a lot of P words that come into this. So preventing epidemics, protecting against environmental hazards, preventing injuries, promoting healthy behaviors. We also respond to disasters and assist our communities in recovery. And then we assure the quality and accessibility of health services. And as you can see, you may not be able to see in the cartoon there, it would be real easy to walk up and ask for an ounce of prevention, but you really can't do it. So our folks spend a lot of time making sure that all those P's get taken care of. So let's talk a little bit about how we do that. So little differences between what most people understand between healthcare and your personal individual healthcare and what we do in public health. For example, the primary focus in healthcare is on the individual. Where in public health, our patient is the population as a whole. Interventions in healthcare include things like diagnosis and treatment, where we really look at three things mainly: assessment, developing policies, and then assuring that those policies are followed. The process for healthcare really looks at the management of patient care, where public health looks more at systems management, about the environment as a whole and how human behavior within that environment affects health. The outcome that we're looking for in healthcare is a return an individual to health. Where in public health, we want to assure that the community stays healthy from beginning to end. So that's what our main goal is. This is the 10 essential services. And as you can see around kind of the circle there, you see that assessment and policy development and assurance. All of it kind of flows around the things, basic things that we do, how we can monitor population health, how we communicate effectively to inform and educate people, how we enable equitable access. And all of it's around that hub of equity to assure that everybody has a chance to be healthy within their communities. So how we prevent epidemics and the spread of disease. How many people have seen or know of our weekly epidemiologist report? Yay, good deal. We send that out every week. It goes up on our website every week. And if you don't look for this information, please take an opportunity to take a look at it. It has good information to be able to talk about what's happening within all of our communities around the state and the nation. So just to give you a sense of the information that's in there, looking at respiratory viral disease, hospitalizations by week, kind of where COVID, RSV, and respiratory diseases are within the season, where measles is, what influenza-like illnesses we're dealing with, gastrointestinal things like E. coli and norovirus. Our epidemiologist works very hard to track this information and to bring it to our communities so that they can use it to take action. And some of the ways that we've seen communities take action is through HR policies on sick leave and things of that nature, to be able to enact things like remote work in a pinch. So this information is very useful, and we try to make it actionable for our towns to be able to kind of carry forward and keep track of what's going on within the community. We also do things like data surveillance. Our epidemiologist, as I mentioned, is looking at numbers all the time to try to track what's coming at us from over the horizon. So looking, at worldwide data, looking at things like measles that aren't, thankfully, that we don't have to deal with in Connecticut right now, but it is surrounding us around the nation. So things like respiratory viruses, sexually transmitted infections, but also going into things like opioids and mental health issues. Our epidemiologist tracks information on those. Foodborne illnesses, tick-borne illnesses. Ticks are definitely on the uptick at this point. Get the uptick. And we've been working very well with our school nurse supervisors here over the past several years, especially since COVID, to really use the schools as kind of a syndromic surveillance to see what's happening there and to be able to work with them so that they understand when to enact procedures like for an outbreak, where that threshold is. So our epidemiologist and our school nurse supervisor and our clinical health services folks all work together to be able to kind of set those protocols so it's standard across those 4 towns. We also work with regional and statewide other local epidemiologists to really standardize approaches and make sure that data is comparable between our district and the other districts around the state. Environmental health, they are the foundation of what we do. So these folks, most of you may think when you think of public health, you think about, the guy out there doing the restaurant inspections, working in the salons, making sure that the motels are safe. These are the inspectors that go out and assure that those regulations are followed appropriately. We do over 1,500 food service, temporary events, septic pools, motels, salon inspections every year. In addition to that, because we get new restaurants, new facilities, they review plans, permits, do inspections for septic systems and water supply wells, and we respond to a lot of complaints. In 2025, we did 182 complaints, and those complaints range from things like hoarding, complex housing issues, you name it, rodents. We see everything. And our inspectors go out there and they work with their partners to be able to address these issues so that you can bring things back and everybody can be healthy. Our community health division, how many people know that last week was Public Health Week? Just me? Well, we were in your community actually last week doing a couple of events during Public Health Week, just to highlight and make sure that people understand what public health is. We're coming into, trying to raise awareness because when public health does its job, nothing happens and it doesn't make the news. When we make the news, there's bad things going on. So we try to remind folks, even when we're not in the news, of the things that we do behind the scenes to make things better. Last week, we actually were over at the senior center. We did a session called Sound Healing to highlight mental health within the community because positive mental health affects your physical health. So we also have grants, as I mentioned, we have a preventive health block grant that deals with chronic disease reduction. We've had this grant for over a decade now, and we've been bringing money in to the communities as a result of that. So this grant really started with a prevention focused on policy changes, We brought all 4 towns together, actually in the old town hall here in Newington, to be able to talk about, what can we learn together to get people to be more active. As a result of that, we really focus on prevention through health promotion. So we have our 4-town walking competition, this Walk This May, which is coming up. So if you haven't, started walking yet, you want to start getting into that mode because it's very nice outside. When I was on the way over here, I saw a ton of people on sidewalks. Sign those folks up for your competition. You want to see that big, gigantic trophy that young lady is holding in your town hall. I know Mayor Trister wants it right front and center. So get people involved in this. The more people we can get walking, the better off that it is. This particular grant is one of those that we actually bring resources back to our community that are tangible. We've had bike racks, bike repair stations that have been part of this, that we've been able to spread through all 4 of our communities to make it more walkable, more bikeable, and that's what we see as a policy change. So those types of policies really affect health overall, giving people the opportunity, the easy opportunity to make a healthy choice. Our vaccination program, many of you are aware that we do mass vaccination clinics here in October. So 3 goals there is really to prevent morbidity and mortality from influenza, but we also use it to practice for a public health emergency. And this really did pay dividends for us during COVID because we had very good plans, had nurses and volunteers that were trained to be able to help run clinics very efficiently. So we did an outstanding job during that time frame to be able to do that. And we use every year our clinics the opportunity to test and make our plans better, to train our volunteers accordingly. So if we have to do it again, we can. As I mentioned, it also provides revenue to the agency. So we made about $57,000 in our last year just doing flu shots. So that brings revenue to the agency. We can do more programs with it. So clinical health services is one of our newest divisions. They do immunizations as well, but they do them not in a mass setting, but more in an individual setting. So we have the clinic in Cromwell Ave in Rocky Hill. And that clinic is actually set up to do things a little bit differently, more on an individual tailored way. So it actually has, we've worked with the Autism Society to be able to set up a sensory friendly clinic. So individuals that may have autism, have issues with doing vaccinations in a mass setting can get an appointment, come in, bring their family, and they take time and they have a very calming environment. Things like beanbag chairs, shot blockers to keep, things a lot easier as far as the vaccination is concerned. And they can take the time to be able to deal with anybody's issue that they have with a vaccination. It really does make a difference, and it helps them, I think, get more vaccinations out there, because we've had families that have come in where they said we could never get vaccinated because our child just could not handle the doctor's setting. But being able to come there with all the tools that we have, their entire family got vaccinated because they had that opportunity to be able to take that out of the equation. So really a very good thing. In addition to that, they do screenings for things like hepatitis C, blood pressure screenings within the community. Our clinical health services are really working very hard to make sure that they get the services out to where they're needed. One other thing that we've definitely been doing for a while now, unfortunately, has been responding to the opioid crisis. So we've been the convener of local response agencies in our towns for several years now. We have 2 grants that help cover the services, one from the state through the CDC, and then one from that we actually work with our Hartford Health Department and some other surrounding health departments to be able to provide information. It's the Overdose Data to Action Grant. So if you see that little map on the ground, all those little dots that are there, those dots are where individuals may have overdosed. And we have that data through, a system that we can look at, and our epidemiologist takes it and says, okay, what can we do? Are there hotspots in a particular area? And we have 2 recovery coaches through those grants that are able to follow up with individuals that may have overdosed. And they actually go out and they provide links to services so that they can get people on the path to recovery. It's been a very positive program, and we continue to grow this out each day. So it is definitely something that I would be very happy not to have to do. And we have gotten, I will say this, we have gotten a ton of Narcan out in the last year. So we distributed, I think, close to 800 doses of Narcan within the 4 communities that we serve, just to make sure that people have the availability of that. If they happen to be somewhere where somebody is overdosed and need that, they train them, they provide them with Narcan so that people can rescue, if it's needed. I love this picture. So this is me trying to figure out what the future is. Sometimes it's dark, sometimes I get faces like that. But really, our preparation for the future really starts with the administrative and health policies that we enact within the district and help to enact in each of one of our towns. So we have a strategic plan that we've adopted. We're about halfway through it. It runs through 2028. And our board members make sure that they oversee those things that are happening with us. We're also in the process of completing a new community health assessment. So if you go on our website, I would encourage all of you to go on our website, not just for the survey I'm about to say, but you'll find a survey there talking about what each individual's perception of health within the community is. So we encourage all of you to go there to the website and complete that survey. It will help us tremendously in how we plan for health improvement in the future. And once again, we spend a lot of time in the community where our health educators, our inspectors are always out there in the community trying to engage folks to do the healthy thing. With that, my last words are always thank you. Thank you for allowing us to be here in your community. Thank you for supporting us over the last 30 years, and hopefully we'll have another 30 more to go.
Hopefully. Thank you
Thank
so
you.
much, Charlie. Any questions from council for Mr. Brown? Councilor Jago?
We just started.
Go right ahead.
How are we gonna be by the end?
I'm fingering the desk. Anyways, we need to thank you, obviously, for all you and your staff do. 2 immediate questions. The first, there's been a lot of coverage about the increase in the tick population and how this year is gonna be significantly more of an increase than the previous years. Can you address that and what you're doing about it?
So what we're doing is a lot of testing at this particular point. And education. I mean, as you know, because we had kind of a lot of snow, but not necessarily as much cold, ticks have a tendency to hide under that leaf layer. They get insulated by the snow and they don't die off as much, which is why you're seeing a lot more ticks this year earlier than what we have in the past. What's concerning to me as a public health professional is many of those ticks are coming back positive with Lyme disease. So we are seeing an increased number of Lyme disease in the ticks that we actually send down for testing. So, you know, anything that people can do to protect themselves as they're going out walking, hiking, working in the yard from ticks, do a tick check afterwards. Use the appropriate prevention measures. You know, make sure that you got the long socks on, make sure that you're protecting yourself. And if you happen to be bitten, to follow up with that. You can bring any ticks to our office and we will actually send them down for testing and get that back to you. So that's primarily what we're doing. We're going to get more information out just because it's seasonally, it's that time of year to start to talk ticks. And within the weekly epidemiology report, you'll see information on ticks every week.
Do you do any communications or education with like scouting troops or?
We haven't engaged the scouts in this very much. That's something that we could definitely look at. Our health educator is willing to go out and talk to anybody.
Great. And then just one more Newington related. The past several years, there was a significant rat problem,
Mhm.
particularly in the center of town. Has that increased, decreased, stayed the same? Are you aware of?
Yes, it's increased, decreased, and stayed the same. And, you know, we're not the only communities that deal with rodents, especially at this particular time. I think with mild winters, we see less of a die-off, just like the ticks, and an earlier opportunity for breeding to begin. So key things with rodents is harborage, to make sure that they don't have someplace to live, food sources, so securing garbage cans and dumpsters and things of that nature. And then, you know, following up, if you do have an infestation, to be able to follow up with, you know, an exterminator or what have you, to be able to address it. The bigger issues that we see a lot is not on the individual level where, you know, a house is a major issue. It's where apartment complexes and things of that nature, where they have dumpsters, commercial buildings and things of that nature that may not be as fastidious as they might need to be. So that's where our inspectors really come in. And they follow up with that to assure that people are doing the right thing, cleaning up appropriately, and then, you know, baiting and trapping where they need to.
Thank you.
Councilor Floyd.
Thank you, Mayor, and thank you, Charlie, so much for being here. It's always such a pleasure to have you here every year. So really, thank you for the time. My colleague asked me a question about the rodents. Even though it wasn't necessarily the case that they all went down, which is what we want to hear, I'll take that answer. That is
No,
good enough.
we are actively working on that throughout all of our communities. So it is something that we do see.
Sure. I just then want to thank you for the work that you do and congratulate you for 30 years, this anniversary in June. We're all, I mean, so satisfied with the work that you do. I am a religious reader of the weekly epidemiological report. So I appreciate that data and how it's compiled and how accessible it is, and the kind of outreach that you do. And I mean, it's just extraordinary, the depth of the work that you do, and in so many different areas. I mean, I didn't know the extent of your work on opioid recovery issues, and 800 doses of Narcan last year is extraordinary. And we are extraordinarily grateful for the, I don't think it's an exaggeration to say, for the lives that you've saved because of the work that you've done. So thank you so much, and let us know if we can be of any further support.
Thank you, sir.
Councilor. Deputy Mayor Adams.
Yes, Charlie, again, thank you so much. I look forward every time you come and provide us with the information. And I know that in the past with rodents and with other issues, you listen and things are addressed as quickly as possible. So I really appreciate that. I know, and actually recently have in my other job, my day job, that you also work closely with Human Services, I'm sure not only in Newington, but in the other 3 towns, and maybe talk a little bit about that and how that collaboration works.
Yeah, I mean, one of the good things about being in public health is the fact that, you know, we can address a lot of different topics, and local health departments like ours can really be a convening agency. So we actually work with our human services agencies to bring them together around topics like opioids, for example. So we have the Central Connecticut Opioid Coalition, which has a lot of our social service agencies, police departments, things, you know, different agencies from the towns, businesses that have gotten involved over the years. And we're the table that actually brings them together. We just recently did a lot of focus group interviews with our social service directors. And the one thing that they came to us and actually told us was how appreciative of the fact that we bring them together regularly so that they can share information, so that they can share resources. There's been a lot of times where around that table, they've made a decision to partner between towns where they never would have had that opportunity before. So we're very proud of that fact. being able to work with the human service agencies as a whole. I honestly think that social services, needs as much support as it possibly can, especially post-COVID, because the mental and social aspects of health really are starting to come around. So we do spend a lot of time with those folks, with Carol Lebrecht, and assure that, we're doing what we can to support them and they're supporting us.
Well, thank you so much, and all of your staff and volunteers for what you do.
Thank you.
Charlie, thank you so much for being here. As has been said, we appreciate all the work that you do for our community, but personally, I really appreciate the job you do as an administrator. I think, there's a lot of people, I think there's, the work that you do is extremely important, but there's a way to do it and there's a way to not do it, and that you do it the way you're supposed to do it. And we really appreciate the work that you do. So thank you for always being here for us. And as I said, please let us know if there's anything to do.
All right. Well, thank you, Mr. Mayor. Thank you, everyone.
Appreciate you.
Thank you.
All right. Moving on, next on our agenda is a discussion from our town assessor, Danielle Dipolino, here to discuss a phase-in approach to a budget. As we've been indicated through our budget process at this point, we're looking at everything possible. This is something that was brought up to us early in the process that we've been looking at, and we felt it was a good thing to bring to the public for discussion. So take it away, Danielle.
Awesome. I just want to touch really briefly with everyone on the revaluation. Just a quick recap. It is required by law every 5 years. We contracted with a revaluation company to assist in the valuation. The 50% increase in values did not happen overnight. They are the product of changing market trends over the last 5 years since the last revaluation. Transparency was really, really important to the assessor's office throughout the entire process. We had a first of its kind in the state data website, which made available to the public the sales data that was used by the revaluation company. I've since gotten calls from other assessors in other towns asking how we did that, and all the credit goes to Monique. So that's just a quick recap of reval before I jump in. I did a little research with the help of James, and in 1979, the town had a revaluation impact study committee that was established by the town council. In 1982, which was the last time phase-in has been mentioned, there was a motion to phase in assessment increases that failed with an 8-1 vote. So statutory considerations, which are always extremely important to the assessor's office. 12-62C allows the municipality by local option to phase in all or a portion of real property assessment increases resulting from a revaluation over a period of up to 5 years. 12-62C subsection B provides the methods of phasing in assessment increases that result from a revaluation. One of those methods is gradual increments based on assessment increase. This is the most common method of implementing a phase-in. It is also the easiest to explain. So under this method, the difference between the old assessment and new assessment is divided by the number of years of the phase-in term to determine the annual incremental increase. The incremental increase plus the prior year's assessment is the amount on which the property taxes are collected. I'll break it down a little better. So first you take the new assessment, you subtract the old assessment to get the assessment difference. Then you take that difference, you divide it by the number of years in the phase-in to get an incremental increase. You take the old assessment, meaning the 2024 grand list assessment prior to the reval, you add that incremental increase each year of the phase-in. And that phased-in assessment times the mill rate is how you get the tax bill. So I did an example. Residential single-family dwelling. So the 2024 pre-revaluation assessment is $145,550. The 2025 post revaluation assessment is 222,740. We're going to determine the difference between the pre-revaluation and post-revaluation assessments. So we take the 222,000 minus 145,000 to get a difference of 77,190. Then we calculate the incremental increase based on the number of years in the phase-in term.
Danielle, can you just tell people of what the phase-in term is, that it's a choice of
Well,
the town?
it is a choice, so you can do you can do up to 5 years. For the purposes of this, I'm doing either 2 years or 3 years. So for a 2-year phase-in, you're gonna divide that number by 2, and you get an incremental increase of 38,595 a year. For a 3-year phase-in, you're gonna divide it by 3 to get an incremental increase of 25,730 a year. Then we're gonna calculate the taxable assessment for each year of the phase-in by adding those incremental increases to the pre-revaluation assessment. So for a 2-year phase-in, year 1 would be 184,145 assessment. Year 2 would bring you back to the 100% reval number. In a 3-year phase-in, year 1 is gonna have you at 171,280. Year 2, 197,010. And year 3 brings you back to the 100%, 222,740. So you're just taking that incremental increase, and that is what you are adding to the assessment from 2024, the 2024 grant list, every year until the end of the phase-in. So we're gonna go over some phase-in considerations. Properties with a negative change are not phased in. So if you have a pre-revaluation of assessment higher than the post-revaluation assessment, that results in a negative number, the assessment for the entire phase-in term is going to be the post-revaluation number. Permits and new construction. So this is assessment increases during the phase-in term, whether it's new construction, completed permits, things that the assessor's office discovers during field work. Any increases that happen to a property during the phase-in term are determined in the same manner as all the other real property. So those increases are also phased in. So if we use new construction as an example, you have a 2024 assessment for what's called an apartment building. And that's at 40% complete. So it wasn't a complete, it was only 40% of the construction was completed. And that affects the assessment, of course. So we have a $3 million assessment for the 2024 grant list. For the October 1, 2025 grant list, I looked at it, okay. Based on my chart of percent complete, I'm at 60% complete for the 2025, October 1, 2025 grant list, which is a $6 million assessment after the reval. Now, we're doing a 2-3-year phase-in, okay? The building is now 100% complete. I have to go to the pre-revaluation database, take the $3 million 40% assessment, tell my system, project's complete. What would the assessment be if this project was 100% complete for the October 1, 2024, before the revaluation grant list? Then I'm gonna go into the post-revaluation database. And I'm gonna say it was 60%. I'm gonna make it 100%. So now I have a new assessment for the October, well, I said 2025. Well, that's the October 1, 2025 database, but we're talking October 1, 2026 grant list. So that new assessment is 18 million. I now have to determine the new difference in assessment for the pre and post revaluation as if the building was complete prior to the revale. So I'm gonna take the 18 million, subtract the 6 million to get the $12 million difference. As it's same as what I did with the residential property. It's just happens to be a much larger project and the values are different because the project wasn't 100% complete when we did the revale. I'm now gonna, calculate the new incremental increases. So for a 2-year phase in, for example, which wouldn't necessarily be as remarkable because 2-year phase in, by the time you're in year 2, you're back at 100% anyway. But the 120, the 12 million would be divided by 2 years for a $6 million a year incremental increase. For a 3-year phase in, that 12 million would be divided by 3 years for a $4 million a year incremental increase. Now I have to calculate the new assessments. So I'm going to take that pre-revaluation 100% complete assessment and add in the incremental increases for the phase-in assessment on this property. So for a 2-year phase-in, I'd have a $12 million assessment. For a 3-year phase-in, I'd have a $10 million assessment. So this kind of plays in on the potential tax bills based on this new construction example. So for an assessment with no phase-in at 100%, the no phase-in taxes with the mill rate of 30.64, $551,520. For a 2-year phase with the assessment of 12 million, the mill rate of 35.88, you'd have a $430,560 tax bill. For a 3-year phase in and a mill rate of 38.31, you only have a tax bill of $383,100. This could be a loss of tax revenue that could potentially help continue to shift the tax burden back to the commercial. So here's some new construction projects that could potentially be complete in the next 3 years. Spark on Cedar, Culver Street, Kitts Lane, the Lewis Street, the Taco John's pad site, Cedar Point Apartments, the building 3. And then there's the Peckham Farm. There's only a couple of Peckham Farm homes left, but the Rockwell subdivision homes, and then other various individual single-family new construction homes that would all have to be phased in. And so we wouldn't get the tax revenue from 100%. Next is assessment ratios. So as everyone knows, the standard assessment ratio by law is 70%. When you do a phase-in, you are departing from that 70% assessment ratio. So in a 2-year phase, if I'm using that example, that single family home I used, the example in the beginning, for phase in year 1, the assessment ratio would only be 57.87%. For a 3-year phase in, you're extending those assessment ratios. So year 1, it'd be 53.83%, year 2, 61.91%. This is really important when you start looking at neighborhoods and streets amongst neighbors, because now rather than everyone being at the 70% assessment ratio, everyone has a different assessment ratio, which other assessors in other towns have found sometimes creates the impression of inequality. So if I'm at, I'm at a 58% assessment ratio and my neighbor is at a 53% assessment ratio, and I'm looking at it, I could feel like, well, are they paying their fair share if my ratio is higher? And when you go to a 3-year phase in, it actually, the range in this one street increases. I mean, you have a 51% and I think or 48% and even up to 55, 56% assessment ratios. Other considerations, grants and reimbursements. So when you do a phase in, the town's equalized net grant list is going to reflect those phase in assessments. This affects the state's cost sharing formula, which I will admit I do not know what that is. That's for those, the people at OPM, but it also affects state-owned college and hospital reimbursements. Because the assessment of exempt properties must also reflect the phase-in assessment, which affects the pilot formula calculations, which are those reimbursements we get from the state for our exempt properties. The taxpayer perception. So Connecticut General Statutes, Section 12-55 requires that assessment increase notices be sent to a property's owner. These have to be sent every single year of the phase-in because we are essentially increasing the assessment. There's additional costs associated with printing and sending 540 increased notices. And this could also give the perception of a yearly revaluation. So let's talk about the revaluation impact on the tax burden. The average, so I just want to go over really quick, average personal property tax bills of year one of the phase-in. So if we have no phase-in, average personal property tax bill with a mill rate of 30.64 would be $3,835. A 2-year phase-in, the average personal property tax bill goes up to $4,453. On a 3-year phase-in, the average personal property tax bill goes up to $4,795. I'm just gonna go over really quick some of the processes we'll have to have in the assessor's office.
Danielle, sorry to jump in, just to be clear, when we're talking personal property tax bill, that's for commercial properties?
Businesses,
Businesses, okay. Very good.
small and large,
Okay, very good.
all the
Thank you.
businesses. All real estate changes will need to be entered into both the pre and post revaluation databases. I spoke with our, the software people at our CAMA, who run the CAMA. I will need an additional standalone computer for that pre-revaluation database. So there has to be a manual entry of the phase-in amount for all properties with value changes over the period of the phase-in. So any of those new construction, any other permit changes that we make from field work, anything like that, we'll have to manually override the phase-in amount because the system requires that we enter those as an exemption. And so we have to go in and manually change all of those. And so, for example, if we do 800 changes a year, which nobody hold me to that number, it was just a quick guess. So phase in year one, we'd have to make 800 manual entry changes. Phase in year two, we'd have to make 1,600 because it would double. We would still have to change the same manual changes we made in year one, in year two. So what will the taxpayers see on their tax bills? They'll see a gross assessment, which is the 2025 revaluation assessment. They'll see their net assessment, which is their current year phased in assessment. And there'll be an exemption amount, but for phase-in properties, it will not show the incremental increase, even though we do have to put that into the system in the exemption box. That will only show actual exemptions such as veterans exemptions. Speaking of which, I just want to go over really quick tax relief and exemption programs. Currently, we're taking applications for the elderly and disabled homeowners tax credit, which has state and local options. The town is very gracious and matches the state benefit amount. I took a look at towns, surrounding towns, and we have one of the best benefits local option in our area. That benefit amount is determined by income and annual taxes. And the filing period is February 1st through May 15th. Also, we have veterans exemptions for honorably discharged veterans. Benefit amounts are based on your VA disability rating. There is also 100% disabled permanent in total veterans exemption, which is 100% exemption on your dwelling only. But you have to have the 100% disabled permanent in total on your VA benefit letter. There's also state and local option low income veterans exemptions. In addition, there's an exemption for those determined to be legally blind, which is a $3,000 assessment reduction proof is required. And a social security totally disabled exemption, which is $1,000 assessment reduction, proof is also required for that. I always say, for more information on available exemptions and tax credits, please contact the assessor's office. We love to answer those questions. And I enjoy talking to people about exemptions and anything we can do to help the public when it comes to that stuff. Questions? I'm sure you have a lot.
All right, Danielle, thank you so much.
Sometimes it's hard for me to wrap my mind around,
That's hard.
so
I guess I'll kick us off. I guess the first glaring thing that I see here is, what happens in the next year of the phase in? I mean, you said it could provide a benefit, but what would actually, we don't, what would the next year look like?
that's based on the budget.
But we would start next year at an increase.
I mean, yeah, if you do a 2-year phase in, obviously by next year, you're gonna be back to the 100%.
And then whatever our budgetary needs are for
Based
the
on,
year.
yeah.
Councilman Draco.
Yeah, just. We're not, okay, the home, for an assessment, it's not like your taxes, your assessment is gonna go up, it's just that you're catching up next year. So when people say that the phase-in is gonna cost the taxpayer money in the subsequent years, from what I understand, it's not really true, because you're not, if you don't do the assessment, you get assessed the entire amount this year. If you do a phased-in assessment, the amount that you're assessed on is a little bit less this year. And then next year, if we do 2 years, then you get assessed on the full amount. But it's not like you're gonna be paying interest or whatever. You're basically, eventually you're gonna pay what you should have been paying in year one, but that would have been all coming out of your pocket in year one. But if you do a phase in, it's just more of a gradual increase. You're not saving money. The taxpayer is not ever saving money, because eventually they have to pay what their house is assessed in, but it's not coming out all at year one, right?
I mean, here's the truth of the matter. Tax bills are based on the budget, right? My job ends at signing the grand list and saying, here's our equalized net grand list. You can take a look and see what would the mill rate be if there was no budget change, and then what the what would the tax bills look like with no budget change?
But the amount that your house is assessed at is still is not gonna change. It's the mill rate depending on what the
Yes,
budget is and what the
that's-
town council
yes.
decides to do
Right,
next year, whatever.
absolutely. Your
So-
mill rate isn't not what determines
Right,
the
so
tax bill.
the phase-in is just helping you pay those taxes, but any kind of increases or whatever will be a result of what the budgets are in subsequent years. I wonder if you can just, because there's some things I've seen on Facebook, and it took me a while, maybe I still don't understand it. A reval is not that the town has this more money flow coming in.
No.
It's just that, because people have been saying, well, now that, all the values of the properties have gone up, the grand list has grown, whatever, the town must have all this extra money. It's not really true, because the
Absolutely not.
mill rate has gone down, so
Yes.
the amount of money that the town needs is the same, regardless, but with a reval, it's just kind of redistributed. But it's not that the town is getting more money.
No, it's just a redistribute. It redistributes the tax burden and makes it more equal, because there's a lot of changes. Like I said, in those 5 years in between revaluations, there are absolutely market fluctuations. And it's the same if it was the other way around. If the market drops in the next 5 years, then the assessments will go down with the
Right.
market.
Right.
Because that's where we get all of our values from.
And I think we benefited 5 years ago or 10 years ago.
We've been very
whatever.
flat for a couple of years.
But, yeah, I think the misconception is that we have all this money, rolling in now, and, that's why we're taxing people so heavily.
Absolutely. I tried at the beginning to have like an open house
Right.
and to help educate the public, and unfortunately, no one really came.
And in terms of, basically, I think what the phase-in does is, it's just kind of preventing, let's say, a one-year shock of a huge tax increase. It's not gonna, you're still gonna have to pay that money back, but not all year one, maybe.
And it's
year
a
two,
shift in the
whatever.
budget,
It's a shift in the budget from the
right? I mean, if you
commercial
look
to
at
residential.
the slide with the, I can go back to it, with the tax burden. Right, it's a shift. And so really, if you look at this revaluation impact on the tax burden, it was essentially more personal property that shifted the tax burden than it was even the commercial real estate. And personal property in its nature sometimes goes down because every year the items that are on a personal property declaration do depreciate. But we've also had big businesses that have moved out, and that impacts that personal property grand list.
Can I interject and just add a little context here? So the personal property and obviously commercial real estate is paid for by the business sector and not by the residential sector. So what we're seeing with this change in the grand list is more burden put on residential properties at the expense of commercial. So what the phase-in is really doing is it's slowing that shift from commercial to residential, so it's not such a shock in year one. I think that's another way of saying
It's
it.
softening the blow for
For
one year,
residential.
but eventually
properties.
everybody will be
Correct,
paying. what they're-
at when you get to the end of the
Yeah.
phase.
It's a destination.
And I
doesn't
think it's
change.
important to remember too, right? The budget will continue to go up. So the impact you're saving this year could end up being an impact next year. Or when you finally do go to 100%, that mill rate could go, and other towns have seen some of that, where at the end of a phase-in, the mill rate has now jumped quite a bit.
But that's
So-
a reflection of what the town is doing in terms of its budget, because even if a phase-in wasn't done this year, we'd still, next year, there could be increases depending on what the town does in terms of their budget. And I know,
And that's why the assessor's office stays out of the budget.
but, and I think you did, investigate, but, again, I'm undecided necessarily on what it is, but I did notice that there's at least 1, 2, 3, 4, 5, 6, 7, 8, 9, like 13 towns who had reassessment, revaluations done in the past 2 years, and they are all doing some form of phase-in, so.
Only, I did some I think it was only, no, because Rocky Hill, I don't think did a phase-in.
Well, Weathersfield, Windsor, Windsor Locks, Bloomfield, Canton, Hamden, Naugatuck, Norwalk, Orange, Torrington, and Waterbury.
Yep.
So, it's not an unusual thing to do, and other towns have done it, so we just have to figure out what's best for Newington residents.
And I think lately, phasing in a reval is a fairly, has not been common in the past, because I don't think there was a need for it. Towns.
Property
feel-
values didn't jump by 50%.
So it's a fairly new, and truth be told, I think assessors are always no phase in. It's kind of what that's always the stance we take, but I just want to make sure you guys have all the facts.
Right, no, thank
And
you.
that's all I want to do.
Thank you very much for the presentation.
Thank you, Counselor. Counselor Gonzalez.
I have a question.
Yeah.
I don't know if it makes sense, but so I understand what would happen the first year, right? But I'm not quite understanding what's happening the second year. It sounds like it's,
Depends on if you do a 2-year phase in or
well,
a
so
3-year phase
just
in.
pick a 2-year, just
So if,
for the
how
heck of
about
it.
3 years a little easier, because then you're now stretching it. And so say, by the end of the phase in, you're back at the 100%. But any changes that happen in between
Yeah.
will be phased in. Those increases will also be phased.
So are we starting off, instead of starting off at 0, we're starting off when we go to do budget and stuff already at a number? We're already up higher. Is that correct?
Not necessarily, no, because what we would do, I think, with the budget is whatever the net grand list is for the phase-in values is what you would be basing the mill rate off of. So if you decide to do a phase-in this year and it's a 2-year phase-in,
Mm.
the real estate portion of the grand list would essentially be half of what it is now.
Okay. I think.
Counselor. Counselor Diakis.
Hi, thank you for all the information. I'm interested in the personal property aspect of it. So I saw that like, with the phase in, they're gonna be paying a little bit more. Do you, you don't need exact numbers, but do you have like a rough ratio of how many small businesses we have in town compared to larger businesses?
I would say the smaller businesses are at least 50%, 50 to 60%.
Alright, so yeah, so they're gonna be impacted pretty
Absolutely.
negatively by
Yep.
this, so,
That's what I thought you had said.
yeah. Personally, I think it's kind of just like kicking the can down the road kind of moves to make, but I thank you for the information.
Thank you, Counselor. Counselor Capella.
So my question just got answered. So in your opinion, you really don't support doing a phase in. I'm kind of feeling that.
It's your guys' choice.
I feel like we're just kind of kicking the can down the road and it really doesn't make any sense to give a little bit of relief, but then burden the small businesses. And then the following year, we're just back and, everyone's paying the same taxes, so. But thank you for your presentation.
Thank you, Counselor. Counselor Floyd.
Thank you, Mayor. And thank you, Danielle, excuse me, so much for coming and sharing this time with us. I was also going to ask that same question. I feel the same way that Counselor Capello does about the impact on our business community. But I want to thank you first. I wanted to listen and hear questions from my colleagues because I've already asked you a trillion questions about this and gotten a whole range of data with your help. So I really, really, truly appreciate that.
That's what I'm here for.
I think I don't have any further questions. I think one thing I'm struck by that you said is obviously that tax bills are based on the budget. And for next year, under a phased in approach, as Councilor Draco said, we're splitting, this increase over a longer period of time, whether it's 2 or 3 or up to 5. But that builds in that portion of tax increase based on that additional assessed value for next year before council considers any changes to the budget.
That's what I
And-
was trying to say,
Oh, sure.
but I don't think I said it right. That's exactly what I meant.
Yes.
And that's, I think there's been some discussion. I know residents have suggested, why doesn't the town look at a 0% budget increase? And the town has never done a 0% budget increase. I have over the last 4 years, 3.6, 2.4, 4.3, 5.35. That's over 2 different parties with majorities on the council, 2 different mayors, and all at an average of about 4%, 3.94%. And it could be less than that. God, I hope it's not more than that, but it's certainly not going to be 0. And that means that there is going to be an additional increase, or it's likely there's an additional increase on top of the built-in revaluation increase, or the phase-in increase, maybe we should call it, under a phase-in approach. And so that to me, looks like rather than 1 year of sticker shock, and God knows it is major sticker shock. Now we don't have 1 year of everything's all right and I'm preparing and I'm good. And then next year, everything's all right and I'm preparing and, thankfully we made it. No, we have 2 years of sticker shock. We have 1 year with a percentage increase and by the end of this, whatever it might be, that is still patently difficult and in some ways unacceptable for people to pay. And we have a second year of that same increase because of the effects of this revaluation that were so disproportionate in shifting the tax burden from commercial onto residential. So
Remember, it really wasn't as disproportionate as you think it was, but it feels like it. for
can you
sure.
talk about that a bit?
I mean, I think, again, when you go back to that slide with the percentage, the commercial real estate only went 22 to 21% of the
21.
tax burden.
It's just that the value of our residential property went up as high as it did.
And we knew that was gonna happen.
Yeah.
We all know, I came here at the very beginning of reval and said, this is what the market is showing.
Yeah.
So.
And that's, I mean, before, and I do have, concerns too about the point you raised about new construction, the revenue from new construction. I mean, that was, I think, 8 different projects that we anticipate some level of further completion on over the course of what a phase-in could look like. And certainly that's a concern too, because that would help defray when we need it most, when we need that revenue the most. We wouldn't get all the benefit of it.
Absolutely, and every year with those new construction projects, that percent complete changes, whether it's 100% or I go from 10% complete to 40% complete. That's still an increase in those assessments that we would have to split.
Yeah. I thank you again. I also, I know that you noted a lot of questions about perceived inequality, and I appreciate the perception, consideration. I am just looking at the data. I hope that whatever decision that we made as a council, that we would rigorously go to the public together with your and other staff's help to talk about what is really happening here and what they can expect over the course of that phase-in. But, just looking at the data, I have had a lot of questions and they've been answered, and I'm still very torn about this, but I really appreciate your help. Thank you.
Counselor DeHaas.
It seems complicated. So you had a slide up that kind of compared the property tax impacts and what the dollar figures would be. Are you able to kind of put one together for what an average household might see in the differences? Is that in here and I
mean,
missed it, or?
Yeah, that would be.
I remember we had kind of like a focus on that one and the changes that would happen to the property taxes for the businesses.
I can go into the real quick and
Okay.
do the math.
If it's not straightforward, if you can just.
I mean, it's,
kind
I
of
mean,
put it
you would
together.
take the 222, so on a 2-year phase in 184, 145 and multiply it by the 3 different, the 2-year phase in for this year. So you would do it by the 2-year phase in mill rate. Actually, when you guys have your open, how about when we finish, I'll go in the back in the
Okay.
room and I'll get it. And then when we have your open discussion,
Later on.
I can
yeah.
absolutely
Perfect.
answer those questions for you too, and you can ask more questions,
Awesome.
obviously.
I think that, yeah, I just think that would
Yeah.
help
I'll
me
put up,
at
I'll get a
least
slide ready.
to
and-
see what the impact on personal property, what the impact is for the residential
Absolutely.
through that process.
Mhm.
Thank you.
Thank you.
Counselor Draco.
Yeah, I think I had asked somebody, whatever, but in terms of the number of residential taxpayers versus the property taxpayers, there's like 1,800 property/commercial taxpayers versus like 11,000 or something residential. And the commercial property tax, it does include small businesses, but it also includes Walmart, Target, some of the bigger.
Absolutely. Yep.
Or, which may not be hurt as much as a small, a landscape or whatever. But some of the smaller businesses also, they are home-based and they own property in town. They live in this town, so they would benefit. So they would be hurt on one end, but benefit perhaps on the other because their residential property assessment would be phased in. And I'm just, again, I just want to, convey, I guess, to the public or to myself, whatever, that the phase-in would help residents simply by preventing the shock of a 1-year valuation so that it's less of a shock. They can kind of adjust their budgets if they're paying attention, of what's going to happen. If they're going to, allowing them to adjust their budgets gradually over a year or 2 years. But it doesn't reduce the total amount that is owed. It's only spreading the increase over time rather than all at once. That's basically, it's kind of it's a tool that softens the blow of taxes, but it doesn't eliminate it. Because eventually they'll be paying on the assessed value of the house at 70%. Okay, thank you.
I know, we have this discussion later in the meeting too, but I know we got a lot of people here and I know we're gonna talk about some more specifics, but I want to get a sense of like what that really means. Like, lessen the shock, lessen the blow, what would that, is it possible to get an idea of like, what would the tax increase be in a phase-in? Under the
What we
current-
can do, and this is probably a good idea, Janet's here too, and so maybe Danielle and Janet could huddle and do a couple of page one, like, scenarios
Yeah.
that you guys have seen, so you can see what that would be, but it,
Right, yeah, that'd be great, because if
Yeah.
it goes, if it's
I would
from,
defer that one to
18% to
Janet.
6% and
stay away
phased
from
in,
the
that's
tax bills.
lessening the blow,
Right.
but if it goes from 18% to 14%,
Right.
is it really lessening the blow, or it's still gonna be a shock?
but I think that if
I'm
you
gonna
guys
defer that
huddle,
to
you'll-
Janet for
yeah,
sure, because
you
I
guys
don't,
can-
Okay, so we'll have
Again,
that,
we
we'll
stay-
talk about that.
sign
in
the grand
next
list and then.
Yeah, sure.
We can see we're trying to rope you in so that.
All right, perfect. So yeah, we'll continue the discussion later on this with some more specific numbers. Thank you so much for being here.
Yeah, thank
Danielle,
you. Of
For all your work on this presentation, really well done.
Thank you, guys.
Thank you. All right, moving right along. Next up is public participation in general. If you'd like to speak in public participation, please step up to the microphone and state your name and address for the record. You have 4 minutes to speak. If you are on Zoom, please use the raise hand function. We'll alternate between in the room and on Zoom.
Hi, I'm Stuart Calais, 641 Willard Avenue. Just to give you a hard example, I pay $5,200 for tax on a 5-room cape. I look at maybe 6,200 with the next probably 6,700 to 6,900 per year tax. So that's what is going to happen. And the only thing that's been attractive in this town is low taxes. The reason I came tonight, John, is I saw you kind of throw up your hands last meeting on camera and say, I just can't see anywhere else to cut. And I'm tired of seeing, this administration going from Republican to Democrat and back and forth. And that's what's going to happen unless you get down to Matt Plewart's 0% tax increase. So you have to make some super unpopular cuts, and you have to do it. We used to run the health district here out of one room in the old town hall with a nurse, and she did just fine. Right, one nurse. Now we have, $1.2 million in salaries with the health district. You have 4 urgent care centers in town. All of them could do, if you wanted to give out a bid, all of them would be willing, probably for 25% of that cost, to do all those items that he said he's doing. That's really unpopular, and we all applaud Mr. Brown, but frankly, you have to make these cuts at this point. You'll probably all lose your jobs if you don't really start making these things. Mr. Chapman brought in assistant after assistant after assistant, assessor and assistant, this and that, raising, the cost of doing government, right? It's unpopular to get rid of these guys. You got to start winning these assistants out of here, even in the school board, which is a $90 million budget. You all probably realize there's an audit committee. That audit committee in the town council hasn't met in 3 years. And Hilda, Kelly, and AJ are all on that committee. They should be going line by line of this budget. You raise your hand, hey, I can't see cuts. That's what these 3 people are supposed to do, is go line by line and find out unnecessary things in your bill. So you don't have to worry about it. Let them do that work. And go with your finance director and say, hey, do we really need $4,500 for parks department to do goose control? Really, do we need to have Bonvita at $25,000 a year put out these porta potties? Right? We didn't need them 3 years ago. We don't need them today. Make that unpopular and just cut them. We don't need that. We don't need to give another $5,000 to Mr. Bonavita because he wants a little added increase in his fee, right? Because it's sort of a pay-to-play culture in this town. Hey, we'll give you that job. Give me a little bit of money as a sponsor of my event. That's pay to play. That's really unethical because the little guys can't do that. But if you give Bonvita that money, well, sure, he'll give some money back to the town. It goes with Stonehenge. You buy those overpriced plantings. It goes with the other guys in town. And you have to kind of just cut out anything non-essential. Mr. DeMayo bought a $55,000 laser guided baseball infield grader. That's a Major League Baseball type of machine. I never saw him use it once on any of the baseball fields last year. A 2x4x12 pulled by a cup could do the same thing on these little league turfs. You just got to stop spending. You give Vachon and Michonne, contracts to do trees, and then somehow they're promoting Mr. DeMayo's overpriced pool idea. So really just be unpopular because you have to cut all these budgets. I've just given you a taste, but my time is up. Thank you.
Thank you, Stuart.
Rose Lyons, 46 Elton Drive. First of all, I'd like to ask you, the next time you go into an executive session and you say you're going to be, or not executive session, take a recess and you're going to be out for 20 minutes or more. It turned out to be like an hour and a half or so. I can deal with that, but you came back so quickly, gave your presentations. I didn't hear why you were cutting anything, if there was going to be any offset anywhere. And there's a gap between YouTube, NCTV, and I was listening on Zoom. Before you could even say, the meeting was adjourned, I couldn't get on. So if you just give it a couple of minutes to let people digest what you've just said, I'd appreciate it. I'm all for cutting budget, but I truly believe that the town side, you've got so many things in there that you can't cut. But the big thing I'd like to see you look at and start looking at like they used to back 5-6 years ago is the CIP. I think that there's a lot of wants there and there's a lot of needs. As I've said before, I have watched that highway garage improvements for the last 10 or 15 years. I don't know how the grounds building has been, how many times it's been on or how long it's been on. But when I look and I see parks, pools, playgrounds getting $200,000 out of our budget, and then in their CIP budget, there's another line item for parks and playfield renovations. I have been waiting since Steve Woods was mayor and Bruce Till was Parks and Rec superintendent to get line item by line item is what they are doing with this money. Because in the last few years, we spent $500,000 on one or more, 1, 2, 3 neighborhood parks. People are on Facebook saying that the equipment at Mill Pond is broken, not a lot of it, but I'm just saying, there's got to be some way to keep track of what's going on here. And I asked last year, and again, I'm going to ask, and maybe nobody else cares, but I do. When the CIP budget used to be presented back in the day, it was the department's request, the town manager's proposed, then there was a CIP committee that vetted these requests, and then it came to the town council and it went back and forth. Yes, it's more laborious for everybody, but you get a better idea of what is needed for the future. And I hate to bring this up, but I'm going to bring it up. The Emergency Operations Center. You inherited that. That was during Keith Chapman. He won a $1 million FEMA grant. And how much is this grant going to cost us when we get through with it? That's what I always ask. When you have these grants, how much is it going to cost us? I've watched the 2 turf fields be put in. 2 turf fields, and now we're still putting money away for a 3rd. And there's other things that haven't been addressed. If someone can answer me regarding the animal shelter $1 million transfer to the building fund, what building fund is that? And that's another thing that it says here, transfer to building fund, animal control shelter, $1 million on this. I know there used to be a town roofing line and then it all got clumped into one thing. And bit by bit, it started getting used for other projects. I know just on one particular project, I called and asked how they got that much money for that project. And they said, well, they took some from here and they took some from there. So we got a shell game going on here too. No disrespect to our town manager. You have been wonderful as far as I'm concerned in answering my questions. Marguerite's in the audience and she knows how long we worked on the Elton Drive terminus. And finally, we're getting some results from that. And I thank all of you at this table as well. People are watching now. This reval is bringing out people. And it's time, I think, to start looking at the CIP and what really needs to be done this year. And maybe let some other departments that don't always get a piece of the pie, take a piece of the pie. Thank you.
Thank you.
Hello. My name is Elena Starr. I'm from 44 Windmill Lane. I'm a homeowner, and this is my fourth time appearing at the 2026 budget meetings. This is my third time speaking before the town council about the proposed budget, and it's not easy for me, but it's so important that I speak out because it affects me very personally and very deeply. So that being said, I am here representing myself as well as a number of other Newington citizens who are also residential property owners like me. We residents are questioning why the Newington town budget increase is 2.98%, yet the Board of Education increase is a whopping 5.63% increase. We realize that both the town budget and the Board of Education budget face the pressures of inflation, rising costs, union contracts, and state mandates. This being said, the town budget serves all 30,548 residents of Newington, and the town budget, with all of its needs, seems to be asking for a more reasonable 2.98% increase. Conversely, the Newington Board of Education serves only 4,000 students out of the total town population of 30,548 residents. Yet the Board of Education budget is asking for a 5.63% increase. That is nearly double the budget increase that the town budget is seeking, and for a vastly smaller population. So clearly the BOE is asking for a so much larger slice of the pie for a so much smaller population of students. And this doesn't seem equitable to Newington residential homeowners who already absorb 72.8% of all excise taxes collected and who are about to be bombarded with an untenable burden when our new property tax bills arrive in July of this year, in 3 months' time to be precise. So we are asking the town council to use this session to continue to dig deeper, to take a more careful look at the numbers, and to continue to separate the wishes and the wants from the essential needs. Thank you.
Anyone else in the room or over Zoom that would like to speak in public participation? Come on up.
My name is Corinne Lapointe. I live at 165 Moylan Court. I haven't been to one of these meetings in many years. I had not planned on speaking, but after hearing so much go on, I feel like I need to speak not only for myself as a retired resident. I was raised here. I raised my daughter here. I'm retired. I own a condominium, and I'm listening to, you say, adjust your budget. My budget is fixed. I'm retired. I do my best. I do audits, I work per diem sometimes, but that's just to be able to do some fun things. So adjusting my budget is a little harder than, other people that still work. I live my condominium. There's a lot of retired people. We've just got an assessment on top of our condo fees. I mean, things happen. I know things go up, but if you could do your best to find where you can cut, and just think of us, the people that love Newington. My mother's still here. She's still trying to make it in her home, 93, and it's not easy for her either, but she loves this town. and I do too. And then on a different note, listening to this phase in, if I understand this correctly, the first year, it'll be a little lighter for us. The second year is going to be terrible if it's a 2-year, because it's going to be the rest of the light that you didn't pay, plus the year that you're going to have to pay, like your yearly. So that's like paying double to me. So it really doesn't make much sense if I understood it correctly. That's all I have to say. Thank you very much.
Thanks so much. Anyone else in the room or over Zoom would like to speak in public participation?
I'll give it a shot.
Go right ahead.
My name is Lou Voigt, and I'm just a renter in this town. And I've been watching this town since my son was born and I moved here. He went through the school system, loved it. I really appreciate the teachers and everything. But over 26 years, I've been working hard, working double shifts and everything else to raise a kid on my own. And I've watched on Facebook, like we all do, because I enjoy Facebook, because I make some really weird comments that people get a kick out of. But I've watched, I think right now we're being haunted by all the money that we've spent in past years on stupid projects, really stupid. This building we're in now, we could have renovated the other one, half the price. Instead of gutting it, tearing it down, finding stuff that was buried, incurring more cost just to have a brand new shiny town hall. And the part was, if we build a new hall, we'll get so many more businesses in. I never saw a study that said this town hall brought in more businesses. I must have missed it. But we've had so many, the pool proposals are really, they should be embarrassed. What was the last year, a $20 million pool paradise for something that's only open for 3 months? Some of these wants that people are proposing are just dumb. And Parks and Rec, this guy, I don't know, this guy here, he brought up a lot of funny points that we're wasting money on. Let's watch these little doodads that we got in this budget, because it's costing all of us. And I don't really understand this phase-in project, because the one screen I saw, I forget who asked that lady that was sitting here, you're not in favor of a phase-in. But that one slide I saw, maybe I'm wrong, I'm seeing things. If you don't have a phase-in, you still can't tell the future, right? Like, we're not telling the future. Nobody's giving us answers. They're trying to make it look good on these screens. But right now, we're kind of screwed until we get serious on these budgets. Our past budgets, we wasted a lot of money. I sat back for years, never came to one of these things because I was working. Came here a couple of meetings ago and I didn't want to say anything, but I wanted to see how the game was played, because everybody runs, I think politics is a game anyhow. But and the decorum, I don't know much about decorum. I'm one of those people that speak what I want to speak. And I don't always please people, but I posted something on Facebook a couple of weeks ago about those stairs. And it showed on what people think about those stairs at Mill Pond. I love going to the park and talking to people. I was talking to 2 ladies from West Hartford, and I put it on Facebook in one of the Newington groups, that they were telling me how ugly this, because I guess they saw my post, how ugly they were. But for all the tax money they spend in West Hartford, they don't even have a decent park to walk in. That's why they come to Newington. So yeah, I'm grateful for a nice park, but I'm leery about all the expenses that are getting claimed in Parks and Rec. And I want to give a shout out to the Board of Education. The last meeting I was here, they asked for 7 new buses, and I'm really happy they didn't ask for green buses, because that's really stupid to ask for in a town crunch like this. We're not keeping up with the Joneses here. We got to do what's good for us. And I really think if we're going to buy 7 new buses, if that passes, we really got to look at the size of buses that we're buying.
I live on Hartford Avenue and I see half empty buses going by. Because a lot of people are driving their kids to school. I guess my time is up. Thank you.
Thank you.
Thank you.
We have one on Zoom. You can sit down, but we're gonna go to the one on Zoom and then you'll go next, all right?
Yep.
Go right ahead, Miss Havens.
Dana Havens, 113 Stoddard Avenue. I'm just calling in to ask if Ms. DiPolino has finished doing a new slide for you guys, because I think most of us are either there or here on Zoom because we want to see how it affects our households. And so I was kind of disappointed to not see that slide in there. And I think it would help everybody, including you guys, make a better and more well-informed decision on whether this seems to be a good thing or not. Okay, thanks.
Thank you.
Hey, Dana.
Hi, I'm Laura Sanzari, 225 Tremont Street. I just think you guys need to look at line items and decrease the budget. We are all have to decrease our budget. And you know, let's face it, all of our households, we all go out to dinner too much, have cell phones, this and that. We all can cut a little bit. We have great services in this town. I don't want to lose any of that, but you guys need to really hone in. And I agree with the other gentleman that spoke. Look at your line items and see what we can get rid of all this waste. The phase in just hit me. It's, you know, after looking at that slide, and I'm not really good at math, so bear with me. You know, so the first year's not bad. The second year, our mill rate's gonna probably go up, and now I'm gonna have more. And then by the third year, geez, forget it. It's like double than what the first year was. So just hit me. I'll pay it, just hit me. Keep our essential services that we need, but get rid of all the fluff. Thank you.
Thank you. Anybody else in the room or over Zoom that would like to speak in public participation? Come on up.
Good evening, Brian Skibo, 63 Stoddard Avenue. After listening to a lot of people here today, it's like really, how high is the taxes gonna go? And where are we gonna be at in a few years? How are your kids that are living with you now, growing up, how are they gonna have a house here in Newington? What's it gonna be, 100%? I don't know, this is really crazy I just listening to a lot of the people, everybody I've been listening to tonight is like spot on. You're all good. I wish I had some power. I can change that for you guys, but I don't. As I said before, I'm still learning. I am on the Board of Education. And I'm learning a lot of things. I'm quiet. I'm a quiet guy. I listen to a lot of people, both sides of the fence, and I make my own assumption. And it's the town is just radically changing. It's not like it used to be. It should be the city of Newington, not the town. I mean, all these buildings going up. Do all these people pay taxes that are living at these big houses, these big, huge compounds? I don't see them paying taxes, really. It's just a really strain on the system. A lot of people saying that cut this and cut that. That would be great. There's a lot of places to cut things. We can start upstairs with 40 administrators. Why do we need 40 administrators making $100,000 a year? 40, 100, that's $4 million. There's some savings right there. Boom. Other than that, I applaud everybody here. Thank you for speaking out tonight, and we'll be back again. Thank you.
Thank you. Anyone else in the room or over Zoom like to speak in public participation? Last chance for now. All right, seeing none. We didn't get any email correspondence, correct? All right. We'll move right on to remarks by councilors on public participation. I have a few points. There was a couple of things stated I just wanted to clarify. Mr. Voigt, The bus item, we cut that item out of the budget already, so that's not happening. Ms. Lyons, you mentioned the dog. I'm not sure what you're talking about, the dog park, but we cut that from CIP. That $1 million item's already been cut out of CIP.
Know where it went to.
It's cut out. It didn't go anywhere.
It went back to the general fund,
Yeah.
so we're not taking any money out this year for it until the idea was that negotiations would happen, and at that time, if the council accepted the negotiated price, we would be able to do a special appropriation from the general fund.
Just looking at the things that's transferred to building fund.
It's been cut from the
Yeah,
budget.
so that's been cut from the budget. Right.
I don't know what I'm talking about, I guess.
No, the verbiage is confusing.
And lastly, to Mr. Skibo, I've heard this about the administrators in the school board before. I think, as being a Board of Ed member, you should know that the town council cannot tell the Board of Education how to spend their money. As a Board of Education member, maybe that would have been the place for you to voice those concerns instead of voting for that budget. And that's all I have for tonight. Any other comments or from council? Council Floyd.
Thank you, Mayor. Thank you so much to everybody who came out tonight. We've gone now several meetings through the budget, and every one of those meetings has been more and more and more and more well attended. And I think that's a really extraordinary thing and a really important thing. I'm glad that folks are looking at this budget with the rigor that we are. It's been said a couple times, that folks are encouraging us to go line by line, and I want to affirm for you that we are. I'll speak for myself. I've now gone through it, I think, 6 or 7 times, line by line. And that's not even the CIP side, and that's shorter. So I'm sure I've gone through that even more. And many of us here have done the same thing, and maybe many more times. So yes, we are going line by line because we treat every single dollar that's in this budget as if it were our own, as if it were our household budgets. We are all property owners here and are going to have to face the ramifications of this budget too. We are scared of the ramifications of this budget too. We desperately want to find the funds to cut that increase, and that is what we're all committed to doing here. So I just want to affirm that. I also wanted to say, as the mayor did, about the animal control shelter and the buses, there were a couple other items specifically referenced tonight, many of which have been cut. So I just want to affirm that too, that you're looking at the line by line budget, you're finding areas for cuts. We're finding the same areas for cuts and making those cuts because we agree with you. So again, just want to thank everybody for coming out and sharing some time with us. There's also a comment made about looking more at CIP. I also want to say, and again, this is public, please go to review our meetings if you haven't been here before, but we've cut over $1 million in CIP items from the town side and over $1 million in CIP items from the board side just in the last month that we've been sitting here. And I'm sure we plan to cut more over the next meeting tonight and the meeting on the 21st. So again, thank you everybody for being here. The points that you're making are very well taken. I take them very seriously, and please don't hesitate to reach out if you have other ideas about areas where we can cut, and God knows we will look at them rigorously and potentially make them on our own. Thank you.
Thank you, Councilor. Councilor Gonzalez.
Rose, I just wanted to respond to you. I think that you said that we were putting money away for a third turf field, but the money that you see being put aside is for the maintenance every 10 years, is it? Every 5 years, for the turf field. So it's not a new one. No, the turf fields have to be redone after a certain amount of years. So that's what that money's for, not a third one.
Thank you.
And I think they only have one. Right? One turf field?
Clem's the only one yet.
Clem. Yes.
Thank you, Councilor. Deputy Mayor Otto.
Yes, I just want to echo what some of my other counselors have said in terms of thank you for all of you folks people that have already left, coming and voicing their concerns, their suggestions. Each week when we have met, we see more and more people in these seats. And I applaud that. This is what we want. We need to hear voices from the town. We are in the same situation as many of you folks that are sitting there and who are maybe at home listening, who will hear or read about this in the next couple of days. We're all very concerned. We're hearing from people that, number one, they love this town. We all do. I, like many of you, grew up here and want to stay here. I'm living in the house I grew up in. But for some folks, they're concerned that that may not even be possible. We take that to heart. This is not something, and I will not hesitate to speak across the entire council, that we are looking at every possible detail and taking the concerns and the questions and the fears that everyone is expressing with us when we start deliberating and looking at things. We have been going line by line on the town budget and everything else, and also looking at CIP very closely. And we've been asking a lot of questions. If there's something that we can't determine or that we aren't clear on, we have, probably the finance people, they're pulling their hair out in little tufts by now, but we have been, and Jonathan, we ask lots and lots and lots of questions. And when the responses come back and we continue to have questions, we will then submit another list of questions. And I want to give my thanks and appreciation to the staff, because you're on top of this and we give you a list, and within a couple of days, we get the answers that we need to continue our deliberations. At this point in time, that's all I have to say, but want you to know that this is not anything that we take lightly, and we have been using our fine-tooth comb to go through every single line possible in the budget. And again, when we have questions, we ask them, and we expect and appreciate the responses that we're getting.
Thank you, Deputy Mayor. Councilor Nieves.
I want to thank everyone that's come out tonight to speak, and for those folks that left, a deep sense of gratitude as well. It is very helpful to hear the voices of our community and to hear what your concerns are. I too live in this town, have lived here for a very long time, and I too am concerned about the impact that the reevaluation is going to have on my household. But we have, as all the counselors here, council has talked about, we have gone through the budget and we are not finished yet, line by line. We still have meetings to sit down and continue to go through items that are going to be cut, need to be cut. We need to ask questions time and time over again to look at how we can do a better job to just address and quell the concerns of this town, the town residents. And yes, we all have to tighten our budgets. I think we've all heard that and we understand that. And it does have an impact. And I think someone asked a question here about giving examples of what the reval and the phase-in would actually look like and how it would affect the different households. And I know Danielle was asked, and I know Danielle and Janet were supposed to go out and at some point give some slides or some information on that. I think that kind of a response would actually be helpful as well, rather than just giving big numbers or talking about the phase-in and the impact of it over 2 and 3 years. I think something more specific per household would maybe help folks understand. But, you know, we've heard the concerns, and we, like I said, I will repeat it again, we are not done yet with cuts and looking at the budget.
Thank you, Councilor. Councilor Taniakis.
Yeah, I just want to address the idea that was brought up about kind of zeroing out like the budget. You know, I don't think that's very realistic. You know, I can't imagine a time in my life where my like food costs, utility bills, gas, all that things stayed flat year over year. You know, costs go up. That's the world we live in this country, right? But that doesn't say, that's not to say that we haven't looked at all those options. We've been running numbers for a month now. So even if we were to zero out the town operating budget, even to zero out the Board of Ed operating budget, we would still be looking at somewhere close to about a 10% tax increase. And that's mainly due in part from that shift that the revals is putting on the residential properties. So just, it's not, you know, quote unquote, as easy as just cutting a whole bunch of stuff and fixing the problem. That's really not gonna help us. It will definitely hurt the town as far as services go in our school system, but that's the battle that we're fighting right now. That's kind of the floor that we're trying to get as close to as possible with what we're dealing with. So I want to put that out that, like, you know, that's not something that we haven't looked at. It's just not very realistic.
Thank you, Counselor. Any other comments from council? All right, and none. We will move on to consideration of old business. First up is budget adjustments. We're gonna do like we did the last couple of weeks. We're gonna go to recess. I'm not gonna say how long the recess is gonna be. But just a couple of things just to, before we get into that, you know, where we're at in the budget right now. As of our last meeting, to date, we've made 3.4 million, or just almost 3.5 million in cuts to the budget. More coming tonight and more coming next week. Currently, the mill rate is set to 30.64, and we'll continue to work that down. But right now, we're gonna go into recess, and we will be back soon. We're all here. Yeah. Oh, I look like Are we back? All right, thanks for hanging with us, folks. We're back from recess. Ready to make some changes to the budget. I will hand it over to Councilor Floyd and Councilor Draco. Let's do this.
Mayor, thank you. Let's. So first we'll make a motion to amend the April 7th motions as follows. Transfer to building fund grounds maintenance garage, code 11100, subcode 8502. That was in the amount of $100,000.
Second.
Oh, we can do them all at once. You know,
Oh, oh,
yeah.
The second one was transferred to CNRE drainage maintenance. That's code 11100, subcode 8501, in the amount of $25,000. And the third was transferred to CNRE drainage improvements, 11100, subcode 8501, again in the amount of $25,000.
Second.
Motion by Councilor Floyd, seconded by Councilor Draco. Any discussion? Councilor Floyd?
Thank you, Mayor. This is not a change to any of those amounts that were cut at that previous meeting. This is just a change to the code that they were cut from, just to ensure that we had the accurate description of the code in the budget.
Perfect. All right, motion second. Any further discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstain? Motion carries unanimously.
Okay. First cut is 10713, subcode 8401, decrease request for circulation downloadable media in the amount of $4,307.
Second.
All right, motion by Councilor Floyd, seconded by Councilor Haas. Any discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstain? All right, motion carries unanimously.
Next is code 10961, subcode 8220, decrease in manager's contingency in the amount of $3,500.
Second.
Motion by Councilor Floyd, second by Councilor Haas. Any discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstain? Motion carries unanimously.
Next is 10240, subcode 8220, a decrease in other contractual services safety officer in the amount of $16,700.
Second.
Motion by Councilor Floyd, second by Councilor Haas. Any discussion? Seeing none, all those in favor? Or do you want to explain it?
So we can.
Yeah,
certainly.
go ahead, explain what we're
So
doing.
thank you, Mayor. So this amount is, a portion of this amount in this item is for cancer screenings for the fire department, which is extremely important. We had a conversation with members of the fire department and got a confirmation that that amount in that account was for all of the eligible members of the fire department to receive that in 1 year. And they had a plan to phase in those cancer screenings. And so they suggested a cut very graciously of $16,700. Again, at the Board of Fire Commissioners, they suggested that cut to us. And so they were very gracious to do it, and we're very happy to do it.
Perfect. Motion second, all those in favor? Any opposed or abstain? All right, motion carries unanimously.
Fund 10235, 8407, decrease fire building equipment.
Second.
16.5.
Motion by Councilor Draco, second by Deputy Mayor Rada. Any discussion on this?
Yeah,
Councilor Draco?
with the understanding that there is funds in the fund balance of 88650 that can cover the equipment and the renovation or the equipment and the mechanics that this was 16.5 was going to cover.
All right, motion and a second. Any further discussion? Seeing none, all those in favor? Any opposed or abstain? All right, motion carries unanimously.
10222, account or line 8220, increase canine control, other contractual services, Bloomfield Animal Control, an increase of $59,250.
Second.
Motion by Councilor Draco, second by Deputy Mayor Rada.
The explanation is that we still do not have a permanent location for the canine facility. So in the interim, there was an agreement, or there has been an agreement made with Bloomfield that we can utilize their animal control facility. And this is the amount that they quoted us for being able to utilize it for a year.
Very good. All right, we had a motion by Councilor Draco, it was seconded by Deputy Mayor Rada. Any further discussion? Seeing none, all those in favor? Any opposed or abstain? All right, motion carries unanimously.
Code 10151, subcode 5501, increase in interest income in the amount of $250,000.
Second.
Motion by Councilor Flores, second by Councilor DeHaas. Councilor Flores?
Thank you, Mayor. This is an addition in revenue. So this is, as we've discussed before, an offset to our budget, even though it is an addition. And this is for interest earnings.
Code one.
But we have to
Oh,
vote. We have to vote. Actually, question, is it listed as an addition or is it it's in parentheses?
It's,
I think that's the way.
That's the way it's supposed to be?
Yeah,
Okay,
that's
I
the way it's
just want to
supposed
make sure. Okay,
Yeah,
very
yeah.
good. Motion second.
Good question.
Any further discussion? Seeing none, all those in favor? Any opposed or abstain? All right, motion carries unanimously.
Code 11100, subcode 8501, decrease transfer to CNRE Chapman Street Storage Building, 75,000 decrease.
Second.
Motion by Councilor Draco, seconded by Deputy Mayor Rada. Any further discussion on this?
The rationale is that for the work that's anticipated to be done next year, between the amount that with this decrease and the amount that's in the fund balance, that they should be able to certainly accomplish the work that they want to get done for the next fiscal year.
Very good. We had a motion and a second. Any further discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstain? All right, motion carries unanimously.
Okay, code 11100, subcode 8501, transfer to CNRE, synthetic turf field replacement, a cut in the amount of $25,000.
Second.
Motion by Councilor Flores, second by Councilor DeHaas. Any discussion? Seeing none, all those in favor?
Aye.
Opposed or abstain? All right, motion carries unanimously.
Code 11100, subcode 8502, transfer to building fund pool improvements, a cut in the amount of $60,000.
Second.
Motion by Councilor Flores, seconded by Councilor DeHaas. Councilor Tiniakis, you're the chair of the pool committee, you wanna?
Yeah,
Share with us.
just to give rationale behind this, the charge of the pool committee is to look at both pools and get a plan going that we can present to everyone. As it stands right now, we only had enough money to do one pool. Given the budget that we're facing and the fact that we weren't really able to execute fully on a plan to present to the town, this cut can be made and then hopefully in the next fiscal year, we could find funds or, we'll have to just wait till next year until we can get it going.
Thank you, Counselor. Any further discussion on this? All right, seeing none, all those in favor?
Aye.
Any opposed or abstain? Motion carries unanimously.
Code 12500, subcode 8501, transfer to CNRE, equipment maintenance reserve, an addition in the amount of $98,767.
Second.
Motion by Councilor Flores, second by Councilor DeHaas. Councilor Flores, you want to explain?
Yeah, thank you, Mayor. This is an addition, you did hear that right, and this is based on updated numbers from staff and our chief mechanic about the depreciation. The equipment maintenance reserve is just the depreciation of our overall equipment assets. This number reflects a more accurate description of that number in our CIP budget.
You good?
111.
Oh, no, we gotta vote, we gotta vote. Any further discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstain? All right, motion carries unanimously. No, you're good.
11100, subcode 8502, transfer to building fund, ground maintenance garage, decrease of 150,000.
Second.
Motion by Councilor Draco, seconded by Deputy Mayor Rada. Any further discussion on this?
The rationale is that we did receive some revised estimates for completion of what they wanted to accomplish for this year. So the money that will still be in this account, 100,000, with this request, 100,000, plus what's in the fund balance already should be more than sufficient to do the repairs and renovations for this year.
Thank you. Any further discussion? Seeing none. All those in favor?
Aye.
Any opposed or abstain? All right, motion carries unanimously.
Code 11100850 transfer to building fund, town hall annex renovations, decrease of 60,000.
Second.
Motion by Councilor Draco, second by Deputy Mayor Rada. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstain? Motion carries unanimously.
Code 11100850 transfer to CNRE, town clerk project, reduction of 50,000.
Second.
Motion by Councilor Draco, seconded by Deputy Mayor Rada. Any discussion on this?
We did receive confirmation through the town manager from our town clerk that given the scope of the project, that he would be able to accomplish at least some preliminary work this year, given the funds that he would be allocated.
Very good. Thank you. Any further discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstained? All right, motion carries unanimously.
And that concludes our changes for this evening.
Awesome.
Do you guys want to? According to my calculations, the mill rate is 30.51. Is that what you
30.51?
have for?
Yeah.
3.51.
Excellent. We are plugging right along. All right, well, that concludes item A in old business. Now we're moving on to budget transfers. I'm gonna go as quick as I can. Councilor Floyd, do you want to read these?
Certainly. Certification in accordance with section 808 of the town charter, I hereby certify that there exists free from encumbrances in the following appropriation in the CIP fund, the amount listed below. Account number 30310-88424, title Camp Avenue, amount $174,122.33. Account number 30310-88431, alumni road improvements, amount $24,515, signed Lauren Rhines, acting director of finance. Resolved that the Newington Town Council hereby transfers the above certified funds to the following CIP fund accounts. Account number 30310-88819, title Road Recon, in the amount of $174,122.33. Account number 30310-88416, title Drainage Maintenance, in the amount of $24,515.
Second.
All right, motion by Councilor Floyd, seconded by Councilor Draco. Any discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstained? Motion carries unanimously. We're gonna move on. Oh, we have another one, right? Yep, we have one more. Oh, you got it? Okay, sorry.
Certification in accordance with section 808 of the town charter, I hereby certify that there exists free from encumbrances in the following appropriations in general fund, the amounts listed below. Account number 960, title Contingency, amount $70,000, signed Lauren Rhines, acting director of finance. Resolved that the Newington Town Council hereby transfers the above certified funds to the following accounts in the general fund. Account number 10160-8217, title Legal Consulting, amount $70,000.
Second.
Motion by Councilor Floyd, second by Deputy Mayor Rada. Any discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstained? All right, motion carries unanimously. Gonna move right along to item C, Facilities Naming Subcommittee Referral, William A. DeMayo Gymnasium at the Mortensen Community Center. Deputy Mayor Rada, would you please read that resolution?
Resolved that the Newington Town Council hereby refers to the request to name the double gymnasium in the Mortensen Community Center as the William A. DeMayo Gymnasium to the Facilities Naming Committee, Subcommittee.
Second.
Motion by Deputy Mayor Rada, second by Councilor Gonzalez. Any discussion on this? Well deserved. All right, all those in favor?
Aye.
Any opposed or abstain? All right, motion carries unanimously. That'll conclude all business. We're gonna move on to tax refunds. Councilor Draco.
Great. The property tax refunds in the amount of $60.89 are hereby approved in the individual amounts and for those named in the request for refund of an overpayment of taxes certified by the revenue collector, a list of which is attached to this resolution.
Second.
Motion by Councilor Draco. Second was that Councilor DeHaas. Okay, very good. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstained? All right, motion carries unanimously. All right, moving on to item 9, minutes of previous meetings. I understand Counselor Das has a memo of all of them. There were several, there's quite a few changes.
Amongst the 4 different sets of minutes, yes.
Okay,
I
very
mean, if
good.
everybody's amenable, I'm happy to forward that to everyone instead of reading them all individually. I don't know if that's possible.
Yeah, so you can just make a motion to approve the minutes as corrected by Counselor Das.
Perfect.
There's nothing crazy there, right?
Yeah, I would entertain a motion to approve the meeting minutes from March 10th, 2026 public hearing, the March 10th, 2026 regular meeting, the March 21st, 2026 regular meeting, and the March 24th, 2026 regular meeting with the changes suggested by Counselor Das.
Counselor Bridge.
I have,
Dr. Bidrick, Dr.
she didn't include mine,
Oh.
on the March 24th, page 4. She said, on the 3rd bullet down, it says Counselor Draco stated that the town land parks are not zoned open space. They are zoned residential. That's actually the opposite. The town land parks are zoned open space and they were zoned residential. And then on the 2 more bullets down, at the very bottom paragraph, zone requirements were put in for specific reasons. We have to be careful on pushing back. I believe what I said is we have to be active in pushing back.
All right, I'd entertain a motion to approve all the meeting minutes with the changes suggested by Counselor Das and the changes suggested by Counselor Draco.
So moved. Second.
Motion by Deputy Mayor Rada, second by Counselor Floyd. Any further discussion on this? Seeing none, all those in favor?
Aye.
Any opposed or abstained? All right, motion carries unanimously. Now we're moving on to resignations and appointments. We have a couple of those. Counselor Floyd, do you want to read the first one? Sure. Oh, do you want to do that one? Yeah, Gail can do that one and then.
Resolved that the Newington Town Council hereby accepts the resignation of Carol Annist as a member of the Town Pools Public Building Commission in accordance with the correspondence received on March 20th, 2026, and effective immediately.
Second.
Motion by Counselor Draco, second by Counselor Floyd. Any discussion on this?
I just want to thank publicly Carol for her work on the pool committee. I know she was passionate about it. She sat through several iterations and she will be missed.
All right, motion by Counselor Draco, second by Counselor Floyd. No more discussion. All those in favor? Any opposed or abstained? Motion carries unanimously. One more resignation.
Resolved that the Newington Town Council hereby accepts the resignation of Peter Hoffman as a member of the Town Plan and Zoning Commission in accordance with the correspondence received on April 6, 2026, and effective immediately.
Second.
Motion by Counselor Floyd, second by Counselor Gonzalez. Any discussion on this?
I'll just also thank Mr. Hoffman for his lengthy service on the zoning commission and a whole range of other service activities in town. And just thank him for the time that he's dedicated to our community.
All right, any further discussion? Seeing none, all those in favor?
Aye.
Any opposed or abstained? Motion carries unanimously. Now we're moving on to new business. Item A is radio tower lease at 100 Cedarwood. I think, obviously this is new business. We're not taking actions tonight. I think we've all been pretty caught up in the budget, so I think we'll probably, review this over next week and then we'll discuss it in the next meeting and take action. Make sense? Anybody have any questions now?
Did you need any guidance from us?
No, the draft lease has been reviewed by our council and their council and so yeah, we're on the same page.
There you go.
Thank you.
Thank you. We're gonna move on to item B of emergency management performance grant. This is, from what I understand, this is something we do annually, we apply for. It's pretty
Correct, yep,
standard, so we'll, we're not taking action tonight, so we will, if anybody has any questions, if not, we can, we'll take action on it at our next meeting. Okay, any questions? All right, we will move on to C, assessment phase-in. Danielle's been waiting.
Thank you, Danielle.
Yeah, there were a few pieces that we were looking for, so I'm glad we have this, so we could, have that information. Or get that information.
Thank you.
Oh, this is great. Thank you.
Thank you so much.
Welcome back, Danielle.
Yes,
Good to be back.
we gave you a lot of time to work.
And it's interestingly enough, I had some slides that I had made and taken out, so.
You didn't need the time?
Not that, for sure, not saying that, but there was definitely some slides I already had that I kind of took out as I was debating what I wanted to put in there, what I didn't. So, you now have the 2-year phase in page 1.
Obviously, this doesn't factor in any cuts, so we've already made it. It's just. where we
Right, just
were
so you know,
before
it's,
tonight, yeah.
that's where I got the other mill rates that I was using.
Based on,
For 2-year and 3-year, I got these from Janet. So then there was a 3-year that got us to the 38.
And do you have the average assessment? in
Getting
there?
there.
Yeah. On the assessment.
So you guys did ask for, so these aren't the, so this is the same example I gave earlier, just so you can see what the different tax bills would be for this property for each mill rate. And then here you have the 2024 grand lift tax bill for that same property. And then the increases for each type of, so for no phase in, you'd be looking at a 17.28% increase, 2-year 13.54% increase, and a 3-year 12.76% increase.
so I'm sorry. It seems like we're doing this.
Go ahead.
If that's all right.
That's okay, go ahead.
So that first year in the 2-year phase in is 13.54. So that's what would be this year. But next year, right, is the remainder of that increase under the no phase in. So 4%, let's say roughly, or 3.5 or something like that. And then that's not accounting for any other budgetary pressures.
Right, so that would be, so for the 2-year phase in for next year, your assessment's at 184, 145, and then you would add that 39 into that. That would get you to 222,000 as the assessment, and that's that 100% assessment next year.
So in other words, it's gonna take, by going to a 2-year phase in on the residential side alone, it's gonna knock about 3.7% off of that average tax increase
For this year.
for next year.
For next
Yeah, and then by the end, you're the same way
Same.
place you'd be, but just, it does slow that on the residential side, that the increase next year. It's not night and day, it's not black and white, but it slows that.
Well, seeing it like this with the dollar figures. I mean,
Food for thought too. Here is the same page 1 with no budget change. What the mill rate would be. And then here's what you're looking at for your average single family homes. Using that mill rate of 27.30. You'll be looking at, just because of the reval and the burden shift alone, is the 6.14% increase.
So
That's on
where
no
that-
budget change, so
that's right.
the budget stayed exactly the same, which obviously isn't reasonable, but. And then I did this too. This is kind of the, if you look at this, slide, you're looking at what impact each type of phase in has on that burden that we talked about earlier, where the real estate would go phase in has 63%. A 2-year brings it to 61%, and a 3-year brings it to 59% of the burden, the overall tax.
And if the mill rate, what's the mill rate where we don't get reimbursement anymore from the state for auto?
32.46.
32.
So we would be getting more revenue.
But, yeah, right, but I don't know if that revenue actually makes up for what we lost.
Right.
When they capped the mill rate at 32.46, so.
Okay.
But you're right, like and then the reimbursement we get from the state next year for this year,
Yeah.
12
Yeah.
months later, that will be a little bit of extra too. But that's not accounted for here.
Right.
Jeez.
This slide is what strikes me the most.
Yeah, I
There's a.
Because you can see the numbers.
Because you can see the numbers.
Well,
That increase.
dollars, like
Yeah.
the percentage is, that seems, okay, that's a big percentage decrease, but $2 less, it's still, and then to your point earlier,
You'd hope it
Councilor
would be a
Draco,
lot.
yeah, it's still, you're still getting that shock to the system.
You could imagine, I think we heard a lot from a lot of folks tonight. And, I think some of them, are just responding to the shock of this budget. They would still be shocked under a phased-in approach, not to mention next year's built-in increase plus the budgetary influence, which might be shocking in its own right, just now over 2 years.
That's kind of why I put it a food for thought in there for you as to what it would look like with no budgetary change as well. Just.
Thank you.
Thank you, Danielle.
Can you email this and the slide from earlier?
Of course.
Yeah, and can we add this into the packet online after the fact so other folks can
Yes.
see it? Okay, perfect, thank you.
We never had it online.
No, I don't
We
think you had it yet.
we can post it like on the assessors page or on the homepage, like.
Okay,
yeah,
well, you can be
we'll-
added to the agenda after the fact, so when someone goes to review the minutes,
minutes.
yeah.
Oh, it certainly can be added for Susan, yeah.
Yeah, that's what I'm saying,
for
yeah,
sure.
just so, yeah.
Sorry, that's my fault. I was working on this
Yeah, yeah.
thing.
That's
No,
right.
no,
No,
I
no,
was
no.
honestly
Yeah,
working on it up
you-
until the last, because
No,
I
you've
wanted
done
to make
an
sure I covered
amazing job.
as much as I could and put as much information in there without overwhelming and also because I know it's a very complicated
Yeah.
process. So my
This
apologies,
is the
there
easy
wasn't
way.
enough in there at first. but-
We appreciate it.
No, you're more
We
than
appreciate it, thank you so much for staying with us. Any other questions on this? Oh, Councilor Draco.
Yeah, and probably not for you, but maybe for Jonathan. I'm just curious, regardless of whether we did the phase-in or not, do we anticipate any increase in tax delinquencies?
That's a good question. I mean, probably, yeah. Would you agree with that, Danielle? I mean, I know it's
I'd have
not
to
really
ask
your
Stacy.
bailiwick.
I'd have to ask. Stacy,
Yeah,
I know.
the simple answer is probably yes. We'd have to sort of think about what the impact would be and we can get back to you on some. of the
Okay,
impact.
thank you.
Any other questions for Danielle? Before we put a pin in this for the night? Seeing none. All right, thank you so much, Danielle. Thank you, Stall. Don't talk about. All righty, so that'll conclude new business. Moving on to a town manager's report.
Yeah, I'm gonna be really fast. Just a couple of things, good news, only good news today. Ross Dress for Less.
Yeah.
Is moving into the old Joann's. So that's really good news. Scott Curis, who's currently.
Dress for less. is moving.
Ross Dresses, the
Yeah,
dress
where is
store.
it moving?
Joann Fabrics.
Oh,
Great
okay.
store.
Scott Curis, who is currently the rec director in Cromwell, will be joining us a week from Monday as our new park and rec superintendent. Can't wait for you all to meet him. He's a really energetic, personal guy. I think he's gonna do great.
Can we get him to a meeting, to the first meeting in May so we can meet him or?
We
whatever that
will
works?
do, yes.
Okay,
Yes, I'll try to do that.
That'd be great.
And we have a conditional offer out for a finance director, so which is really exciting news as well. And then, and I was gonna make the announcement about Connecticut K-9, we're gonna be moving to Bloomfield May 1st, but unfortunately, we've been essentially, our time with Connecticut K-9 will end at the end of this month, so we'll start bringing the dogs up to Bloomfield on May 1st. That's all I got.
Any questions for Jonathan?
Just a tremendous thank you beyond words, truly, for all your work on this budget, your assistance.
Well,
your quick
I
answers to
take
questions.
very little bit of the credit, Danielle, Lauren, and Lauren stepping up in this circumstance is heroic. And then obviously what Danielle has done, through reval, through this phase of discussion and just dealing with a resident concerns. They're the stars and, I'm just a pretty face.
And we thank you both profusely too. God knows. Thank you.
Appreciate it. All right, moving on to council liaison committee reports. Tiakis?
Just to let, the library book sale is gonna be next week. So it starts on Friday, goes to Sunday. I will be there waiting for my wife to buy books, so please come.
You should buy one too, read a few. It's good. Thank you, council. Any other updates from council? All right, seeing none, we're gonna move back on to public participation. If you're in the room and like to speak in public participation, please step up to the microphone and state your name and address for the record. If you're on Zoom would like to participate, please use the raise hand function.
Rose Lyons, 46 Alton Drive. I know I don't get a vote on the council, but as a resident, stands in line at the assessor, or the revenue office on July 1st and January 1st or sooner. I would prefer to just pay what I owe you and be done with it. I'm a low-income senior. I earn or get between pension and social security, $40,000 a year. My increase in my taxes is going to be $1,500 a year, which calculates to about $4 a day. I'm also the recipient of energy assistance, and fortunately I got $1,500 in energy assistance. So it's probably going to be a wash. Not everybody, I don't know if it's a blessing or a curse not to have a lot of money, but there are some programs out there. I also get $500 in senior tax relief. So I'm urging anybody that's a senior that has a low income to go to the assessor's office, speak with Danielle. A few years back, they also instituted a program that those that were eligible could pay their taxes on a monthly basis with no interest. I'm not quite clear on that subject, but that's another thing that people have to ask. And it's getting to the point now that the seniors, and I keep hearing the ones that are out here are the seniors talking to, and the ones with probably 3 and 4 kids and things like that. Unfortunate. Mortgage is paid. I can go from pension check to social security check, but they should look for some help in other areas. Again, I urge you to review the process of the CIP. I see where, and maybe I'm mistaken, you took 25,000 last time from the drainage maintenance, but 24,515 is being put back in from another transfer from a CIP account that was, I'm not even sure which one it was. It's in your booklet here, but anyway. The other thing is, I'm just curious, I saw that there's and I know you don't answer, but there's an animal control officer position being advertised, so we don't have an animal control officer, or I mean, whatever the case may be. That situation, we have to have some kind of resolution to it, and I'm glad to hear that we're able to work it out with Bloomfield for this year. And just one final point, as far as my saying that there were 3 synthetic turf fields, I didn't mean that there were 3 separate ones.
Gotcha.
The first year, there was the new one, then we put the money away, and I think we even used some ARPA monies or something like that for that. And those are the things you have to really look at. I mean, I get it. It's great for the kids and everything else like that, but there's also our dredging of our pools, not our pools, of our brooks, and there's the detention and retention ponds, and there's a lot of things out there that need to be addressed. And I see that some things were taken from the town clerk's office, and I'm sure if James said he can do without it, he can do without it. But in retrospect, when I was told to hold off on things and have seen things being held off on, as you wait to do them, they get more expensive. So it's tough. It's tough trying to make the cuts, but like I said, try and cut from the people that keep getting it year after year and give it to some of the people that don't always get it. Thank you.
Thank you. Appreciate it. Anyone else in the room or Zoom that would like to speak in public participation? Seeing none. Going to remarks by counselors. Any comment from council?
Thank you for sticking with us, Rose.
Thanks for hanging out tonight. Rose, appreciate it. Yeah, thanks everyone for coming. Counselor Tiniakis.
I just want to say, I know like we waited a long time and stuff like that, and we all want to go home, but I don't think it's a bad thing. I appreciate the collaborativeness of you guys working this out and working together on the budget. So just thank you. I know it's not easy going through those discussions together.
Thank you, Counselor. Yeah, for that. All right, moving on to informational items. I don't think there are any. All right, item 17, entertain a motion to adjourn from.
Second.
Counselor Floyd, who seconded it?
Second.
Counselor Floyd, second by Counselor Haas. Any discussion on adjournment? Seeing none, all is in favor? Any opposed or abstain? All right, motion carries unanimously. We are adjourned 11:27 PM. Great job.